Hey, this is Dr. Kurt Reyes, also known as Tubby Doc, and I want to just do a quick video about bariatric surgery and its relationship with weight control medicine or obesity medicine. Currently, when you look at the landscape of bariatric surgery, primary care, and obesity medicine, it's very disjointed. If you are a patient who has had bariatric surgery, I want you to consider finding obesity medicine or weight control medicine physician who practices this. So that way we can avoid regain. So this is a review of the SOS trial, the Swedish Obesity trial. This is a great study. It was 20 years. Look on the x-axis, a 20-year study, change in weight on the vertical axis. Let me walk you through it. The control group is up there. You can see that. And full gastric bypass, that's GBP. You can see that's the one that loses the most weight. The VBG is basically the sleeve. And then there was banding, which is now falling out of favor here in the United States. The whole takeaway is look what happens in general between year 1 to year 2. Between the surgical date and the first year is rapid weight loss, which is awesome. Look at what full gastric bypass gets you down to percent. And then between 1 to 2 years, you start seeing a little bit of weight regain here or here. Not in banding, but interesting. If you look at the surgical data, about 80 to 90% of the people will follow this course, will gain a little bit and they go down. And this is still a great weight loss. They settle around 27%. Now, remember, this is the Swedish obesity. So this is in Sweden. Can you believe that we have unhealthy weight in Sweden? Anyways. And then the gastric sleeve, you can see they settle right around close to 20% in the long run at year 20. Other people will not do this. They will go all the way back up to their weight and sometimes a little bit more. Same thing with the sleeve patients. And I see those patients after their weight regain. This is when I usually pick them up a couple years later. So if you've had this surgery or one of these surgeries and you've lost a lot of weight, and it's been 1 to 2 years, maybe 2 to 3 years, you're starting to notice that weight regain. Find an obesity medicine physician so we can get you started on that medication. So instead of doing this weight regain all the way up, and then you find someone who knows how to treat it, why don't we just stop it right here? Maybe at year 3, and maybe we actually make you lose a little bit. We keep it off. Same thing with the sleeve patient. I'm sorry, with the full gastric bypass. And maybe at year 3, you find someone, or ideally just after surgery. The earlier, the better. We are not integrated right now. So be aware of that. The bariatric surgeons and the medicine people, we are not integrated into a comprehensive plan like this. Not yet. Maybe at the higher centers are doing it, but I'm not aware of it. So the idea is that if you got this surgery done, yeah, you probably do fine for the first couple of years, but if you start seeing rapid weight regain, definitely get us on board, because what I have found in my practice, those patients, I get them when they're full regain, is they're very sensitive to the GLP-1 receptor agonists, or the Mounjaros, the Ozempics, the Zepbound, the Wegovy. They do very well. Let's avoid full weight regain. And you see someone like me, you go back down. My top weight loss person is just that story. Full weight regain after gastric bypass, and now she lost 170. She's looking great. She's actually kept it off for 4 to 5 years. So just keep that in mind, that if you had this surgery, let's go get one of us involved, someone who's qualified, that knows what they're doing with these medicines, and let's cut it off. Don't go all the way back up. Let's change that trajectory. Maybe you just gain a little bit back, and then maybe we keep you at 30% and we'll beat this study. All right. I hope that helps, guys. This is Tubby Doc out. If you had one of these surgeries, please find one of us to help keep that weight off in the long run. All right, guys, I'll see you at the next video. Tubby Doc out.